And to accommodate the Pharmacia 920 Sion 3-piece foldable implant, we will enlarge this incision to approximately 3.5 millimeters. I simply use a 15-degree blade and extend each wing of the incision. A separate keratome certainly can be used. We used to measure very carefully, however, after some experience, we now just approximate that. For silicone lenses of a non-uniform central thickness, handling has historically been a little bit of a challenge. So recently, newer instruments have been designed. We will demonstrate to you the instrumentation that Rhein has produced, and we've had the pleasure of working with Rhein in the design of these instruments. This is the Nichamin number 2 loader, which we'll use in combination with a new inserter. As you can see, there are 2 aspects to each blade, a lower half and an upper half, and within the lower half, a hollowed out groove is present that will engage the edge of the optic. We align the radial mark on the upper blade such that it is approximately at the central point of the lens optic. We then close the blades, and the upper aspect of the blades will act as a canopy to prevent upward and outward excursion of the lens, yet the lower blade has captured the outer edge of the optic and securely folded it in a symmetric fashion. Since I am left-handed, I will grasp the lens with the Nichamin 2 inserting forceps, which have been slimmed down to allow a smaller incision, yet still maintains a very good grip on these sometimes slippery implants. These are excellent for the lower to medium power 6 millimeter optic lenses, as well as the new 5.5 millimeter lenses. We place the inserting forceps into the window, as it were, that it is created by the 2 aspects of each blade, grasp the lens in that fashion. The tying forceps tips of the loader can be used to tuck the leading haptic if desired, and if it'll stay. There we go. We'll then place the implant with my dominant left hand. We try not to instrument the clear corneal incision. We use a forceps with no tooth on the top and just a small groove on the bottom to lift the incision edge. We'll then move in, place the leading haptic under the anterior capsular leaflet, and then release the lens. The wider blades of these inserting forceps, as you can see, allows for a rather slow release if desired. That is particularly helpful in the case of a weak capsule or some type of intraoperative complication. We actually usually release the lens a bit quicker than that, but if needed, that is a nice option. The lens is then just dialed into the capsular bag and centers beautifully. Remaining viscoelastic is removed. We then reconstitute the anterior chamber with 3 solutions. We begin with a quick injection of additional lidocaine in preparation for the miotic agent. You're doing very well, Mrs. Andrews. Just keep looking straight ahead. She is extremely well dilated, as you can see. We do routinely use a miotic now that we've gone to nearly complete use of non-injection anesthesia in order to bring the pupil down so that these patients will have better immediate recovery of vision. Once the pupil begins to react, we then gently flush some of the miotic agent out to prevent a brow ache and excessive miosis, and reconstitute with BSS, and also lightly hydrate the incisions. With the 3D diamond, I find it's very rare that we actually have to hydrate the main incision. However, the side port will leak on occasion because of intraoperative manipulation. A quick test with the finger confirms this. Eye holds pressure well. and we'll just confirm that there is no leakage. Once again, we'll demonstrate the use of the Rhein Nichamin 2 loader and inserter. This is another Pharmacia 920 Xeon 3-piece silicone implant. We'll take a moment to assure ourselves that the lens is flat on the loading case. Then surround the lens with the loading device, taking a moment to be sure that we are centered nicely. We'll then close the jaws, creating the fold. Inspecting the lens, we see we have a nice symmetric fold. The upper blades of the device prevents migration. We'll take the Nichamin 2 inserting forceps, place them into the window created between those two arms, grasping the lens. The inserter has a lock on it to facilitate a secure grasp. We'll use the tying forceps to tuck the leading haptic, which is something I do like to do, for the 6 and 12 o'clock folds. Lens is then placed through this clear corneal incision. This is about a 3.7 millimeter incision for the somewhat higher power IOL. Trailing haptic will then be dialed in. One additional illustration of a Pharmacia 920 3-piece foldable being inserted with the new Nichamin 2 instruments from Rhein Medical. Lens is placed on its flat surface, centered between the radial marks on the folding jaws, grasped, and then the inserting forceps are placed across the folded optic. Haptic tucked. Even if the lens does become a bit wet, these inserting forceps have a remarkably secure grip. Of course, one tries not to wet this lens. And as you can see, a nice controlled delivery is possible. The lens is then either dialed into the bag or trailing haptic can be tucked with inserting forceps.